Thank you, Megan. Good morning, everyone. It's 8:02. This is Deanna Diamore, Health Director for City of Norwalk. This is the Board of Health, 8:02. We're convening the meeting. Present, we have Terry Quell, Norman Weinberger, Vincent Amoruccio, who are board members. We have Megan Fogno and Brian Weeks, who are Norwalk Health Department staff members. Good morning, everyone.
Morning.
The first item on the agenda is approval of the April 27, 2021 meeting minutes. Do I have a motion?
I move they be admitted.
Thank you. Do we have a second?
I'll second.
Terry seconds. Do we have any comments, any edits, corrections to the minutes? Any discussion? All
Excellent job on the minutes.
Yes, thank you so much.
Multitask.
All in favor, say aye.
Aye.
Any abstentions? Anyone decline? All right, all in, motion passed unanimously. The second item on the agenda is public participation. Megan, do you see anybody who would like to speak?
No, there's nobody there.
Nobody present, no attendees. Okay. All right. The third item on the agenda is the director's report. So I wanted to give some updates related to staffing updates about our building and then some funding opportunities we've been pursuing. So we've recently hired a new contact tracer. Her name is Sherry. She started last week and she's doing really well. Really excited to have her on board to help us. As you know, we received funding from the State Health Department under the ELC funding. It's called Epi and Laboratory Capacity funding. So we've onboarded her and she's doing really well and helping to support our contact tracing. And we're in the process of filling another contact tracer role right now. So hopefully we'll have that filled soon. We've also posted an advanced practice. It's an APRN / physician assistant position that we have posted for the next about 3 weeks. It'll be posted for a month for a part-time position. So appreciate all of you who are getting the word out about that and finding us some good candidates so we can bring somebody on board. We also have filled our Assistant Director of Health Environmental Health role. We've Bill Mooney, who is our sanitarian, who's been working at the health department for over 20 years, has recently been promoted to an assistant director position for environmental health. So congratulations to him. He is going to be starting in June in that new role. As you remember, Tom Closter had retired earlier in the year. And so he's been staying on board, working with us part-time to help us as we transition and being able to fill these roles, which are taking longer than we would hope because we've all been busy with the pandemic and responding to the pandemic. So excited to have Bill start soon. But we're really sad, of course, that Tom Closer is officially going to be retiring. We've been able to hold on to him and been relying on his support so much. And, you know, he's been at this health department for about 40 years. He's done such an incredible job. So I just wanted to publicly thank him and acknowledge him, and we'll find other ways to thank him and acknowledge him when he officially retires. But again, he has such an important role in the city and he does so much for the community and for our partners. So thank you, Tom. We also are getting ready to post the health educator job as well, posting. Teresa looked at the job description. We've made some edits and modernized it. As you remember, Teresa started in that role over 10 years ago. And so we've taken a look at that job description and now we're working with personnel to make those updates so we can post it. So I'm excited about that as well. So those are updates related to staffing. As far as the building goes, the mayor announced that City Hall would be open for visitors without appointments last week. And so we followed with that with the health department for visitors, and they're starting to, we've been conducting business by, telephone, email, and then people have been coming to the building all along, but we've been working with them like outside the building, being able to see them and accommodate them. But we are And of course, we've had patients coming into the building for a while now. But now, so we're working on, our updated process where visitors are signing in, checking in with the front desk or with security. We are requiring masks still indoors. As you know, we are a healthcare facility, so we follow the rules and guidance related to healthcare facilities. And we all know that, fully vaccinated people are allowed to not wear their masks indoors, but we wanted to obviously follow the guidance for healthcare facilities, and knowing that, we're still looking at our population in Norwalk, still trying to get more and more people vaccinated as time goes on. So that's been going well. We're also preparing for WIC to return in person in a few months as well. So right now we're following the guidance of Optimus, which holds, the contract for the region. And so right now we're looking at September for in-person visits to start again. But we know that could change and get updated at any time as we move forward. But we've had staff who are working in the building and seeing clients remotely. And then funding, wanted to let you know that Teresa and Brian has been helping support a funding application. We've been working with the state health department and some of our other partners on getting additional funding for community health workers. So we're working with the state health department on an application. We also worked on another application related to community health workers. The partnership that we've had with the Family and Children's Agency has been really great. As you recall, the Connecticut Health Foundation provided funding to us to have community health workers to help support the pandemic response. And we're looking at moving forward and how can we embed community health workers into our operations, not just with, COVID response, but also recovery and just chronic disease prevention and other great, health promotion activities. So we're thinking about that moving forward. And we're also, I've reported in the past, the IAP program having additional funding to support community health workers related specific to COVID. So that's moving forward as well. Does anybody have any questions or comments related to any of those updates? Megan, do you have anything to add?
No, all sounds good.
Sounds like it's pretty darn busy there.
Always. All right, so the last item on the agenda is COVID-19 updates. So Brian has prepared a presentation to give updates on where we are as a city. And so Brian, can I pass it along to you? And then I'll talk about our own activities related to, our vaccination and other activities.
Sure. Yeah, I can. I'll keep it very quick. Let's see. Hopefully everybody can start seeing the PowerPoint popping up. But hey, everybody. Brian Weeks here. And so just kind of quickly going over COVID-19 situation for the city of Norwalk. As you can see on your screen right now, these are the county indicators from the state health department. And so this is for the time period of May 2nd to the 15th. This is updated obviously every Thursday by the state health department. But as you can see, what's really cool here is for leading and secondary indicators, every county in the state of Connecticut is considered low. This is like one of the first times that we've officially entered this, for thankfully to the the weather obviously improving, vaccination obviously getting rolled out much more so, and obviously prevention measures kind of being enacted the way they are. So for Fairfield County, leading indicators, we're at 7.3 new COVID-19 cases per 100,000 of the population per day. So looking at it from obviously a little bit different perspective for each city and town, you can see how the city of Norwalk is currently in the orange. We are just in the orange level. Actually, we're very close to being in the yellow level. And so for the data from May 2nd to the 15th, so we're at 10.0 cases per 100,000 of the population, which is really great. Just before that, we were at 11.6. So things are kind of slowing down in terms of that downtrend, but nonetheless, it's much more significant in terms of even the previous month of where we were at. So this is really great news. And as you can see, a lot of the red and even orange has disappeared from the state of Connecticut. Now looking in terms of just our general data, we have about an estimated 11,510 cases, which is just an increase of 18 from the previous day for the city of Norwalk, with a total number of deaths of 224. When you look at it from the recent 2 calendar weeks by age groups, by decade of age, Still kind of the usual suspects in the sense of being less than 50 years of age. You can just see the significant proportion in comparison to the other age groups above that. So, obviously the highest at 18.2% is the 30 to 39 year old age group, but then tied with it, right, on the left hand and right side is the 20 to 29 and then 40 to 49. So, and still what's also, important to keep in mind too is also, 10 to 19 and 0 to 9. But again, you can see that kind of significant proportion and makeup of the new COVID cases relative to May 9th and 22nd. So in terms of vaccination efforts, phenomenal work everybody's been doing in terms of the percent of the population of all ages who have at least one dose of COVID-19 vaccination. That's 57.71% as of May 19th. So again, really great work. And so technically this number is higher when you remove the age groups that aren't eligible for the vaccination at the moment. So keeping that in mind as well. But really great news. So obviously, again, big thing to monitor for is the variants. So this is obviously the most recent update from the state health department. And you can see how for the variants of concern, this is from May 20th, you have the UK variant still at the large proportion. So when you compare it to the below table, this one's from the CDC, the top one from the state health department, we're somewhere around, about 40 to 51% proportion of the UK variant in our population. Now, keep in mind the CDC one is actually reflective 4 weeks up to April 24th. So this is yet to be updated once more. So that's almost a month out. But nonetheless, we're somewhere around there where obviously the UK variant is the largest proportion of, SARS-CoV-2 inside the state of Connecticut. So something to keep in mind. And then obviously, looking at, say, B1351, which is the South African variant, or P1, which is the Brazil-Japan variant, and then also the New York variants, 427 and 429. They're still making up a smaller proportion, but they are somewhat increasing in terms of their presence. So something always to closely monitor. But obviously, UK variant being the most significant in those changes and holding steady in that regard. Should any of the variants of interest, be escalated to variants of concern, that's we're obviously closely monitoring, as well as the state and the CDC doing it as well. Just one other thing, for all of us to keep in mind, the state also has developed their own graphics as well. But, obviously tis the season for travel as school year kind of wraps up, students graduate from college, families plan vacations, some might have already traveled. But we just want to send out a reminder there because we've had scenarios too where individuals have traveled, especially to states that have a higher incidence of COVID-19 and just taking the proper precautions. The CDC, these are graphics from them, have stratified the difference between domestic and international travel. And, what fully vaccinated and not vaccinated individuals should do. And again, keeping in mind fully vaccinated applying means or implies completing the full vaccination series relative to the vaccine you receive. So again, if you get Pfizer and Moderna, all the 2 shots, the time interval in between, and then also the supposed, about 2 weeks development of immunity afterwards. So factoring that in, and that's what equals fully vaccinated. But just keeping in mind the recommendations that are tied to it, just the precautions also tied to it as well. I just wanted to emphasize that, and obviously tis the season for travel because the weather is phenomenal out there and everybody wants to take full advantage. The other thing to keep in mind, obviously, with the better weather too, is, vector-borne diseases. So keep in mind about ticks and, eventually mosquitoes will definitely be increasing in their presence too. So not things to overlook as well as we enjoy the weather. So that's kind of my update from here. Thank you.
Thank you so much, Brian. Does anybody have any questions related to any of the data?
The way
Yeah,
the data
Brian.
is being presented is excellent. So thank you for that.
Absolutely.
Yeah, I agree. I like the data a lot. I had a question. I don't know if you have the answer. So in my professional life outside of the board, I'm connected to a lot of work going on in India. And I've heard that the variant in India is highly transmittable. So I'm wondering, have you heard anything about any possible third wave going on this year, or later on, or early of next year?
Yeah, so that's an excellent question. I've been hearing preliminary studies coming out in regards to the Indian variant that kind of explains why it's been so successful in spreading in India. Yeah, there's even that very initial figure saying that it's 50% increased transmissibility tied to that variant as well. In terms of obviously making its presence in the United States as well as really spreading, that's something we have to always anticipate. It might just have, really, this variant's produced every day, right? Some people just have the unlucky situation where the virus mutates in their body and it develops maybe a mutation that's helpful to the virus in terms of its transmissibility and its severity too, or not. And so it's just if it has the perfect conditions, right? So if it has a very large unvaccinated population, especially one, especially if it's able to evade the vaccine, a large number of people that it can spread to, if it's also able to increase its transmissibility. So, in terms of respiratory droplets, having a higher presence and therefore being able to transmit to others, various factors that play into it. So it's something to keep in mind. Obviously, with these travel recommendations and other prevention measures, hopefully everybody doesn't let down their guard completely. They're still managing and realizing that COVID's always going to be here. And we always have to anticipate, especially as the fall comes around, looking at the previous year's data, it's kind of has some level of seasonality to it, that it might come back. And so we also have to consider, the various other things that have played in, in terms of this consideration. So whether booster shots are going to be needed, right? Whether, obviously, if there are going to be any future, requirements in terms of people having to, quarantine to some extent or whatever it is, whether contact tracing is going to get modified. I mean, that's yet to be seen. In terms of the India variant really getting a hold of the United States, that hasn't happened yet. We're all hoping it does not, as long as obviously everybody takes the proper precaution measures, especially when they travel. And it's not necessarily, again, limited to the Indian variant. It could be a bunch of other variants that could change the game too. But yeah, we do expect, at least in the fall, something to pick up to some degree. But the hope is we'll also have more people vaccinated too. And so we'll be obviously better prepared for that too. So not something we can predict fully, but we can obviously anticipate that things might pick up around that time. And whether it's different variants playing in the playing field at that time that's causing that, we have yet to see. So one thing I actually wanted to mention that I forgot to show really quick, and you guys are obviously all familiar with because you received the emails earlier, but just to show it really quickly, this is just, what the mayor's office and the health department have been working on in terms of just, these notices. This is also just for the general public to be aware of as well. In terms of getting, updated visuals and more data and information in regards to what's going on in COVID in the city, as well as in benchmarking and comparing us to other cities and other activity going on in the state as well. So I just want to emphasize that this is the webpage. And then as well as, obviously the document itself, just kind of scrolling through it, it's got a nice letter from the mayor that the communications office has developed, all this other data, metrics, the charts, everything, the pie charts, the heat mapping, so people know what's going on relative to the most recent 2 calendar weeks, vaccination data, things of that nature. And so we have a plethora of information. We go into great effort to make this as detailed and helpful as possible, always looking for input and to improve it. But at the same time, it really just hopefully gets the message and the understanding out there to the community much more than before. So looking forward to hearing any other input that everybody else has had. But thank you again.
Thanks, Brian. I'm really loving the new updates that Brian and Josh have put together. It's just really incredible work that they've done. All right. Any other questions related to data? So Brian talked about vaccination and our progress as a city and as a whole. So it's really great to see the progress that we're making. In terms of our clinics, we had a clinic last week at the Maritime Aquarium that went really well, and we're going to be having additional clinics for them we have one this Wednesday from 4 to 6 p.m. And we have others scheduled through the end of June at the aquarium on Wednesday evenings. And we've worked on combining both our first and second dose clinics into one clinic. So staff and volunteers are staffing one clinic a week moving forward for now. And then we're also supporting the bedbound program. So our latest numbers are 60 people had been deemed eligible for our bedbound program. 47 have been vaccinated so far. There are 10 more that are scheduled for this Thursday. So all the staff and the volunteers are doing great. And that's been a great partnership with Norwalk EMS. It's been great to work with them. So that's been supported. Corey, our new public health nurse, has been coordinating those efforts, and she's been working with our emergency response team volunteers and Norwalk EMS on that. We also have started the Vaccine Equity Partnership Funding Program. If you recall, we got funding from the State Health Department to support equity work in vaccine. And we're working with the Norwalk Community Health Center, Community Health Center, Inc., as well as the Family and Children's Agency, and then AmeriCares has been advising us and working with us. And so Teresa and them, they're all working on sort of like a master calendar of like who's where at what point and which part of the community. And we're going to work with Josh and the mayor's office on communicating that out. That's been one request from some of their community members, is as they're doing outreach to the community members, to be able to say on which day at what time where different vaccine locations will be in the city and in the different communities. So we're really excited about all those partnerships. Norwalk Community Health Center has been doing their medical mobile unit. We have been in discussions on continuing our community clinics and outreach in different locations. So while we'll have like Maritime as a standing location, we're also thinking about different locations in the community as well to do. And then we're also working really closely with the State Health Department on the Griffin cars. If you recall, they've come to the library, the Carver Center, and we're working really closely with the state on identifying additional locations for vaccination. Because they've been a great help and support to us as well. So we're all working on coordinating all these pieces to get as much vaccine out there and make it as easy as possible for people to get the vaccine. FEMA was here earlier in the month. That was also really successful. They administered about 527 doses of vaccine. They were here Friday, Saturday. They administered Pfizer and J&J. And we're continuing to see, we're accommodating walk-ups in our clinic. So I think we had over 100 walk-ups our last clinic. So that's been successful too, as a way to get additional people vaccinated. Megan, can you think of any other updates related to vaccination?
No, just that it's great. I love the partnerships we've had with the movie theaters and with Maritime, them welcoming us into their locations, their staff. Has been amazing, helping us. This is not what they do. They don't run vaccine clinics, but they're jumping right in there and helping us always. And it's really nice to be at like a neutral place. I feel like it's not a healthcare setting, so it seems very calming. And people are coming up, and they're, last week somebody came with their kids, and they were looking to get their kids vaccinated, and so we were able to coordinate to share with them information where they could bring their kids to get vaccinated. So it is really great to be in South Norwalk, have the foot traffic around, and it's been really, really nice to be out there. Also, it's been nice to do one clinic a week instead of every day. So I think for staffing and volunteers, it's been really nice. So yeah, it's been great.
Thank you, Megan.
I think in the same context of partnership, what the Norwalk school system is doing with the Community Health Center and with Griffin is really terrific. We've gotten a lot of kids vaccinated, and parents who've come along with them have been vaccinated. So that's been very good.
Great.
Yeah, so as Dr. Romberger is mentioning, so they've been able to do vaccination in all the middle schools, and they have the 2 high schools today, I believe. So that's been really exciting. And Megan, thank you for mentioning Bowtie, because that was such an incredible partnership to be able to vaccinate there, and those clinics went really well. All right. Those are my updates. Does anybody have anything else related to COVID before we wrap up today? Staff are been able to take some vacation days, so that's been nice before the end of the fiscal year. I want to
Great.
share that. There's been plenty of times there's been attempts to take days that doesn't work out, but you know, there has been some success. So I'm happy to report that.
Great.
Yeah.
Well-deserved vacation days for
For sure.
sure.
Yeah. All right. Well, we'll wrap up this morning then if there's nothing else.
Great. Thank
Right.
you for all the
Thank you
good
all.
information.
Thank you.